that you can make a huge difference to these patients, not only in terms of symptom control, but in terms of control of their ultimate level of disability and X-ray change. And a lot of this is mediated via early referral, education of primary care, and use or treatment of these patients in the setting of an early rheumatoid arthritis clinic. This is a picture of a lovely place in the west of the UK, in Wales, Rossilly Beach, which has a 3-mile-long beach, very good for surfing and a good antidote to the world of rheumatology. Thank you.
Thank you so much, Deirdre. That was a truly enjoyable and informative talk. We're going to have questions at the end of the session. I have 2 housekeeping announcements. The first is please switch off your mobile phones. And the next talk, which is by Professor Nighat Mir, who's Professor of Rheumatology, Head Division of Rheumatology, Father Memorial College Hospital, and also has been my trainer and a colleague. We work together in the Division of Rheumatology. She's going to talk about the biologics experience in Pakistan, the Paris trial, and this is regarding the rituximab data that has been used on patients in Pakistan. Professor Nighat Mir.
Rahim, Professor Zafrullah Chaudhry, Dr. Abid Farooqi, who's the chief organizer of this conference, and our president, Javed Malik, and our guests from abroad. I'm really grateful that they've been able to join us, Professor Dr. Gibson from Guy's Hospital, and Dr. Deirdre here, and David Cruz to follow. And our colleagues from other towns and from other cities, students, colleagues, Assalamu alaikum. It's a great pleasure to be here today. And my task today is to discuss the interim results of Pakistan rituximab study. And just before I go on to the trial itself, this is what we are seeing in our clinics daily. Wheelchairs and wheelchairs and wheelchairs. And this is, I've been here for the past 12, 13 years, and this is still the fate of the patients with rheumatoid arthritis in our country, because they fail to reach the rheumatologists. And I think Deirdre's talk very clearly signifies the importance of early diagnosis, aggressive treatment, and early referral if your patient is not achieving remission, because this should not be fate of these patients in these days and times. And I think we are all here, we have to share this blame that we haven't been able to reach out to the patients who are suffering from this disease, which if diagnosed early and treated early would not let them suffer the rest of their lives in wheelchairs. So I hope this would be a take-home message for everyone. Before I go on to my talk, the goal for the rheumatologist and the treating physician should be to achieve remission. And remission is complex, as just pointed out. And it has been shown that progression of damage occurs in patients who are assumed to be in clinical remission. And I've seen most of the time when patients are referred to us, patients are taking painkillers, they're on steroids, they're on Hakim's medicine, and it's the patient's perception that I'm doing fine, there's nothing wrong with me. It hurts here and there, but that's okay. And sometimes when this perception is shared by the physician also, who lacks the expertise in assessing the disease activity, then that would result in an outcome which is not acceptable in this day and age. So we have to make sure that whenever the patient comes in to see us, we assess the disease activity and we aggressively treat the patient so that we can achieve this remission. And if you see, the clinical remission is one in which there is no clinical synovitis. and there's a normal acute response. And we all know in our clinical practices that patients are far, far, far away from remission by the time they come to the rheumatologist. And when we have just mentioned that for the